Good day, my eager to learn classmates. Today, my group will be presenting on anti-diabetic drugs, and our drug for today is Mounjaro, also known as tirzepatide. Our group members include Olivia Bowles, John L. Ferguson, Kozia King, Maureen Nuri, Mona Toussaint, and Quentin Woods. Our objectives for today's presentation include classification, generic and trade names for the drug, pharmacokinetics, patient characteristics, medication considerations, side effects, and nursing interventions and education.
Mounjaro is an injectable prescription anti-diabetic drug for clients with type 2 diabetes mellitus. This drug has been approved this year, May 2022.
Tirzepatide is a GIP receptor and a GLP-1 receptor agonist. Tirzepatide amplifies the first and second phase of insulin secretion and helps with the depletion of glucagon levels, both in a glucose-dependent manner. It has a steady-state plasma concentration following 4 weeks after each once-weekly administration. Tirzepatide is injected subcutaneously in the thigh, abdomen, or in the back of the upper arm. The maximum plasma concentration ranges from 8 to 72 hours. After subcutaneous injection, the viability of tirzepatide is 80%. Tirzepatide selectively binds to and activates both GIP and GLP-1 receptors that targets native GIP and GLP-1 hormones. It has a rate of being highly bounded to plasma albumin by 99%. The half-life of tirzepatide is 5 days, which allows the once-weekly dosing. Tirzepatide is metabolized by the proteolytic cleavage of the peptide backbone. It is excreted by the kidneys through feces and urine.
Mounjaro is a single-dose pen that is normally administered subcutaneously in doses starting at approximately 2.5 milligrams once weekly. After 4 weeks of usage, the dose increases to 5 milligrams. If there is a need for additional glycemia control, increase the dose in 2.5 milligram increments after at least 4 weeks on the current dose. You must note that the maximum dose intake is 15 milligrams. Also note, 2.5 milligram dose is not effective for glycemic control and is intended for treatment initiation. If the patient has missed a dose, advise them to take the dose as soon as possible within 4 days. If more than 4 days have passed, they must skip the missed dose and administer the next dosage as scheduled. The patient may experience nausea, diarrhea, decreased appetite, vomiting, constipation, and abdominal pain. No dose adjustments are necessary for patients who have renal or hepatic impairment, patients with pancreatitis, hypersensitivity reactions, or to discontinue the dosage immediately. And patients with gastrointestinal diseases are not recommended to take this drug.
In the maternal population, poorly controlled diabetes in pregnancies can increase the maternal risk of diabetes ketoacidosis, preterm delivery, and preeclampsia. This drug has not produced any extensive evidence to claim that it can harm the fetus, but it has yielded through animal research that there is a likelihood that the fetus can face risk after being exposed. Thus, this product should only be used during pregnancies if the benefits justifies the potential risk. As for the pediatric population, successfully executing safety when using Mounjaro has not been established in patients under 18 years old. Without a doubt, the pediatric target audience has a high sensitivity to most drugs, as previously stated, but so does the geriatric population. Therefore, Mounjaro has performed 7 clinical trials in pertinence to the geriatric population. Mounjaro has treated 1,539 patients, which is about 30.1%, who were 65 years of age and older, and 212 patients, which was 4.1%, who were 75 years of age and older. Despite the ages stated, there has been no overall differences in the safety or efficiency between the younger and geriatric patients.
Some nursing interventions include patient education, explain the rationale for administering the drug, site and method of administration, list of common to severe side effects, and monitor glucose levels, blood pressure, and pulse.